Did you get jolted awake with severe 10 out of 10 pain in your big toe joint? If so, there's a good chance you're experiencing a gout attack. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. Gout can lead to extreme pain in your foot. It becomes very swollen, very red, and very warm, but there are ways to get through the pain. In today's video, I'm going to discuss how to manage your gout attack to help relieve your pain as quickly as possible. Before I do, let others know about these videos. Please like, comment, hit the subscribe button, and share on social media. This will help others find this information. Experiencing your first gout attack can be a very scary experience. You go to bed just fine and wake up to this excruciating pain in your foot. People call the office wondering how they broke their foot while sleeping. That's how painful gout can be. Here's the good news. Gout isn't dangerous. Certainly not your first attack. If you get recurrent gout attacks, it can cause problems with the joint. But in no way is gout a life-threatening condition. But it hurts. A lot. And it can ruin your day or even your week if you don't address it. First of all, what is gout? Gout is the increased concentration of a substance called uric acid. Uric acid is a byproduct of protein digestion. It's normal. Usually, we're able to excrete the uric acid without a problem. So, how is there such a buildup that causes gout? Some people under-excrete uric acid. That means the uric acid isn't removed in the urine. Most of the time, people overproduce uric acid. This can be because of increased weight, poor blood flow, compromised kidney function, alcohol use, and dehydration. Dehydration is a huge factor here in Houston, where we're often hot and humid. We dehydrate and don't even realize it. That increases the concentration of uric acid in the body. Excess uric acid forms crystals and deposits in a joint, commonly the great toe joint. Why the great toe joint? It seems very specific for a condition that's widespread through your body. Your feet have less circulation coming into them and are a colder part of your body. Uric acid is sensitive to temperature changes and crystallizes where temperatures are cooler. The big toe is the furthest point from your heart and is cooler, which makes it the ideal place for uric acid crystals to form. Well, how is gout diagnosed? I often joke that it's something that I can diagnose from the doorway. The foot is so red and swollen. You look so miserable from the pain. It's clear to me that you're suffering from gout. Yes, I'll take an x-ray to make sure it's nothing else, and we'll get a blood test to check your uric acid levels. The gold standard for diagnosis is to draw out crystals from your great toe joint. This is done by putting a needle in the joint and withdrawing crystals. Those crystals would be evaluated by the lab. But here's the thing. If I were to stick in a needle into an area of extreme pain, you'll never talk to me again. Because of that, it's not something I regularly do. I like you too much for that. Here's what you can do at home when you wake up with a horrible pain in your great toe. Even though it may not feel like it, the pain is due to inflammation of the joint. So we'll treat it like any other inflammation. Start off by putting ice on your foot for 15 to 20 minutes. Ice is a natural anti-inflammatory and can help to reduce the pain you're feeling. Also, elevate your foot as high as you can, and do that while you're applying the ice. Next, it's time to hit your medicine cabinet. You're looking for anti-inflammatory medication. The most common ones you'll have are ibuprofen, which is Advil or Motrin, or naproxen, which is Aleve. If you're able to take these medications, they'll be helpful to reduce the inflammation and resolve the pain. Another option is acetaminophen, or Tylenol. This isn't an anti-inflammatory, but it's a pain reliever, and you can take it along with an anti-inflammatory to help with more pain relief. There are other medications you can take, but you need a prescription for them. These include medications like indomethacin or colchicine, which work to reduce the pain and swelling pretty quickly. I sometimes will use a steroid to also calm the inflammation and pain. Steroids work really quickly, but when you finish them, there's sometimes a rebound of the gout flare-up. If you've had multiple gout attacks, it's worth keeping these medications available in your medicine cabinet in case of another attack. But if that's the case, how do you stop gout attacks from happening? This is important because multiple attacks can wear down the joint. The uric acid crystals can also form lesions called tophi, which can be painful. If we don't prevent these situations, they often require surgery to resolve them. The first thing you need to consider is your diet. Uric acid is a byproduct of protein digestion, so you'll often experience an attack after a rich meal of shellfish and red meat. That can be made worse by dehydration. Alcohol is dehydrating, so when you're at your neighbor's for a barbecue and have some beer, make sure you hydrate well to limit your chances of gout. In fact, drinking water and staying hydrated is so important to limit gout attacks. If you're overweight, getting yourself healthy by losing weight will also help to reduce the chances of developing a gout attack. If you've done this, but still are suffering regular gout attacks, then we can talk about medication. The most common medication is allopurinol, which helps you excrete the uric acid. It works great at a relatively low dose for those who need it. I don't prescribe it after your first attack. It might just be a one and done situation. But if you have multiple attacks a year, this is a good way to prevent them. If you follow this plan, your pain should be relieved within 24 hours. The most important thing is to treat it as quickly as possible. The sooner you treat it, even with ice and elevation while you're waiting to come in, the faster your pain will go away. Thanks for taking the time to watch this video. Please take a moment to like, comment, share on social media, and be sure to hit subscribe so you won't miss another video. If you woke up with a severe pain in your big toe joint, if your foot is red, hot, and swollen, don't wait. Call us and we'll get you in to make sure your pain goes away quickly. That link is in the description. Thanks so much for watching, and have a great day.